Ladies and gentlemen, came across a story today. Look, we have talked about and it's not us, we've referred to these stories before, the obesity epidemic. That's what it's being called. And I see the numbers today, and we're going to talk with Chris LABOS in a sec. First time in 15 years, the American Academy of Pediatrics released new guidelines for treating childhood obesity. Mm-hmm. First time in 15 years. Here are the numbers. Now, remember, these are in the U.S. I imagine they're fairly comparable here. So, first of all, childhood obesity rates have continued to rise over the past years, I guess decade and a half now, from 17 to 20%. Since the 1980s, obesity rates have tripled in children and quadrupled in adolescents. Since the 1980s. That's not 100 years ago. Now, because of this, the suggestion is that we can treat childhood obesity with medication. And they've even now decided perhaps a surgery might be the way to go for children as young as 12 years old, which I'm sure to many people seem appalling that you would have to bring in surgery to treat obesity for a child. We wanted to talk more about this. Dr. Christopher LABOS, of course, joins us from time to time. So, Dr. LABOS, let's start off with this. It seems kind of radical just to see the word surgery for a 12-year-old. So why is this happening?
Well, it seems radical, but I would argue that it shouldn't be, because the minute you change the paradigm and you change your thinking about obesity from a lifestyle thing to a disease that needs treatment, this is the treatment for obesity. 20, 30 years ago, there were no effective medications to treat obesity. Bariatric surgery was not a commonplace procedure. But nowadays, there is quite a lot of evidence to show that medications like semaglutide, which most people know as Ozempic, medications like semaglutide and bariatric surgery not only treat obesity, but prevent the complications of obesity. You can essentially cure diabetes if you have bariatric surgery. There's, quite a bit of evidence about that. You can prevent the cardiovascular issues that come from obesity and diabetes by performing bariatric surgery. So when you look at obesity as a medical problem that needs to be treated, the real question is, why wouldn't you want to treat a child that has this problem? Because you are going to be preventing the long-term medical issues that come with it. And so, yes, it's shocking because we are still, I think, to a certain degree programmed to think that obesity is something that you treat with diet and exercise, which is true. You obviously need to have a healthy lifestyle. But the medications and the treatments to take care of this problem now exist. And we have to recognize that for a lot of people, the problem with obesity is not simply a question of lifestyle. It is a complex metabolic and hormonal problem that has led them to develop this problem, which is not easy to treat with diet and exercise alone.
Okay, that addressed some of what because I was just thinking, how did we end up here? I mean, I know it's been a gradual thing. I know that kids are more sedentary, but there's more to it than that, it sounds like, Dr. LABOS, when you talk about like thyroid and hormone conditions.
Well, here's the thing. Yes. Now, we are definitely more sedentary as a society than we were in the past, and we definitely have a poorer diet than we had in the past. But the solution to this is not as simple as telling people eat healthy. Mm-hmm. It's hard to eat healthy. If you've been grocery shopping recently, you know how expensive fruits and vegetables have become. And so if you're on a limited budget, you are more likely to eat junk food because you probably can't afford to eat fruits and vegetables. So when you create a situation where it's impossible for somebody on a limited budget to eat healthy, you can't then blame them essentially for eating unhealthy and having, the metabolic problems that come with it, like obesity, like diabetes, like high blood pressure. So there's a lot of very complex issues. And people say, well, why don't we treat the underlying problems? Yes, absolutely. We should address the issue of the high cost of food. We should absolutely address the issues of disparities in socioeconomic conditions that make it more likely for people who are less well off to develop medical issues. We have to address all of that. But you have a patient sitting in front of you that is suffering from obesity for a variety of reasons. Why would you not want to treat them with medications and surgical procedures that have proven to be wildly effective? Mm-hmm. Imagine now that you're a teenager who is overweight or obese for a variety of reasons. You have diabetes. You're taking medication for diabetes. If you could do a successful bariatric surgery and get it to the point where you can reduce and possibly even stop medication, I mean, that's essentially a cure. So we shouldn't we unfortunately sometimes tend to get locked into these ways of thinking and don't realize that the science has changed. So the reason why the American Academy of Pediatrics has updated its guidelines is because the science about weight loss medications and bariatric surgery has changed and has demonstrated itself to be an extremely successful intervention for preventing a lot of the problems that a lot of these children are going to be subjecting themselves to if we don't actually treat the medical issue they have, which is obesity.
Well, there are parents probably listening to this thinking, yes, my child perhaps is a little overweight now. Maybe he's obese or she's obese now. But I believe that over time, some of these problems, some of this issue can be resolved on its own by lifestyle, by working out, by eating correctly, and that surgery is pretty much the most radical thing you can do. They would rather wait it out and basically let it play out and hope that things get better. Is that no longer, a result that makes sense anymore?
So let me ask you a question. Would you make the same argument if we were talking about high blood pressure?
No, we wouldn't.
Right? If you had a child with high blood pressure, would you just leave them with high blood pressure and hope that the problem would take care of itself?
Right.
Now, that's not to say that you can't also do lifestyle interventions, and you definitely should do lifestyle interventions. And in fact, in the American Academy of Pediatrics guidelines, they actually strongly recommend lifestyle interventions. And of course, an ounce of prevention is always worth a pound of cure. So all of the things that I mentioned before about making healthier food more affordable, all these societal issues that we have to go, incorporating physical activity into school curriculum so kids at least get the exercise that they might not getting at home, making it part of the regular school day. All of these things are important issues in terms of preventing obesity at a societal level. But this is a slightly subtler argument. This is if you have a child that is suffering for this problem, there are interventions and treatments available now that you can try. So definitely try to, change diet, exercise more. Absolutely. But if you have a patient that is suffering from this, and especially somebody who is suffering from the metabolic complications of this, like high blood pressure, like diabetes, leaving them untreated is not the most ideal path forward. These treatment options exist and should be considered for the people that have a major problem. This is not for somebody who's, a few pounds overweight or who's, maybe, not quite as fit as they should be, right? These are medical interventions for people who have actual medical problems. So if you meet the medical diagnosis, the medical definition for the metabolic complications of obesity, I think the reason why these guidelines were put out was to highlight to people these interventions exist, they are available, and they should at the very least be considered and discussed with patients and their parents and offered to them to know that this is an option that exists.
I want to get in a couple of things real quick before we have to wrap up. So someone is texting in right now, and this is true. We have to some degree normalized, maybe even glorified obesity to some degree. People say, well, if you're talking about this, you're automatically fat shaming them. How much of this has come into play to read that we have seen numbers in adolescents, never mind kids, because they're almost the same, quadruple basically in the last 40 years by virtue of the fact that we're normalizing this is okay. You're still probably okay.
I think the problem is when things change very, very slowly, we sometimes don't realize how much they changed. Now, there's a difference between fat shaming somebody and identifying a medical problem, right? If you're going to make the argument that you need to be thin to look beautiful, that is incorrect, right? And that's where the distinction lies. Because this is not a question of looking good. This is not a question of conforming to some sort of societal value. This is treating somebody that has a medical problem. If you have diabetes, and if you have diabetes because you have been overweight or have had obesity for some point of your life, that needs to be treated. That is a medical hormonal problem that can now be addressed because of new drug development. So we're treating a disease. We're not trying to address somebody's, what's the word I'm looking for, like body image or something like that. So there's a distinction to be made there. We're treating a medical diagnosis. We're not trying to conform to some sort of societal perception of beauty or something like that.
Okay. Look, I think, as I said, when we during the intro, this is going to be an eye-opener for, I think, a lot of people, right? Because we have reached the point now where we have to be very careful when we talk about obesity and fat shaming and everything else. And I wonder, when you see something this radical like surgery for a 12-year-old to control obesity, do you think this message sinks in that this is a solution?
I think it's a solution, and it's an important thing, right? Because, listen, you should never shame somebody for having obesity in the same way that you shouldn't shame somebody for having epilepsy. It's a medical diagnosis they have. Prior to this, we had no treatment. Now these treatments exist. Not everybody's going to be eligible, and it's not appropriate for everybody either, but they do exist, and that's the point, and sort of making people realize that these treatments are available, that this is not something radical or experimental. These are established medical procedures. They are going to be available, and they are going to be useful for the segment of society for whom they are medically appropriate, and that's the key. We have to look at it from the medical point of view, not from the societal point of view.
Last thing, really, really quick. What about the issue that if you have this bariatric surgery, people who have had it, it works for a while, but then eventually they get back to where they were to begin with?
I don't think that's strictly speaking true. There are some people who do regress, and of course, you can overeat for a variety of reasons, but they have been largely successful. When you look at the studies that have been done 6 months, a year out, there are some very, very radical improvements. And if you get to the point where you can stop your diabetes medications, if you are preventing heart attacks, now this is the adult population, obviously, but when you're seeing that kind of benefits, that's truly impressive. So it's not that there aren't occasional suboptimal results. Absolutely there are. But there have been many, many very, very good successes.
And I would think the follow-up with a child being involved would be much more rigorous than perhaps that with an adult. Is that a fair assumption?
I think that's a fair assumption, too. And don't forget, the easier you treat this problem, the easier it is. Of course, if you're talking about somebody who's in middle age and they've gained a lot of weight, it's very hard to keep that weight off as we get older. So the younger you can intervene, the younger you can prevent the problem, the better off you are. So treating these things in childhood is probably going to be better than letting them progress into adulthood when many of the issues may have become solidified in place.
Dr. Christopher Labos, appreciate it. Thanks so much. And Happy New Year, by the way. It's our first time talking to you this year.
Happy New Year to you, too.
Thank you. All right. So there you go. It's going to be interesting to see what reactions. Now, this is a fairly new story.
Yeah.
How will people react? How will parents react?